Her doctor recommended a fifth cortisone shot. Let me explain what cortisone actually does to a joint, the good and the bad. Cortisone is a corticosteroid, a synthetic version of cortisol, your body's natural anti-inflammatory hormone. When injected into a joint, it suppresses the inflammatory cascade. Specifically, it inhibits phospholipase A2, which blocks the production of prostaglandins and leukotrienes. Those are the chemical messengers that cause swelling, pain, and just the heat. That's why it works so fast, right? You're chemically shutting down the inflammatory response at its source. But here's the problem. Inflammation isn't just damage, it's also part of repair. Those same inflammatory signals, like they're recruiting stem cells, stimulating collagen synthesis, and coordinating tissue healing. When you suppress them repeatedly, like over and over, you're suppressing repair too. The research on repeated cortisone shots is actually pretty concerning. A 2017 study in Radiology followed patients getting cortisone injections and found accelerated cartilage loss and increased progression to joint replacement compared to like baseline. Then a 2019 JAMA study showed similar results. More cartilage damage, faster progression. The mechanism makes sense. Corticosteroids inhibit chondrocyte functions. Those are your cartilage producing cells. And then those in turn reduce proteoglycan synthesis, the molecules that make cartilage springy and resilient. Long term, you're trading like short-term relief for accelerated degeneration. So when should you use cortisone? When there's an acute flare or when you need immediate relief? Or for diagnostic purposes, like if the pain goes away, we kind of confirm the source of the pain. Buying time before a planned surgery. So like if you're trying to avoid a surgery, then hey, it can give you some time. Getting like 1 or 2 cortisone shots a year is maybe reasonable, right? But if you're on shot 4 or 5 and you keep needing more, that's a signal that the joint is degenerating and cortisone isn't changing the trajectory. Stem cells and exosomes, along with PRP, can help when cortisone can't. That's when we should talk about approaches that actually address the biology, not just mask it. If you've got any questions, hit me up as always.